Okay, welcome everyone. So what we have now, it's Men's Health Week. We are looking at prostate cancer. My name's Derek Wood. I'm the SHE manager for SMB. I'd like to introduce my colleague Tom.
Hello everybody. My name's Tom. I'm the physiologist for SMB JV. So we're going to be going through, as Derek said, prostate cancer today, and just the, as we said before, telltale signs and what it actually is, and just explain it in a little bit more detail. So, what the prostate actually is a small gland above the pelvis. And it is found in only men. It's roughly about the size of a satsuma. And the main function of the prostate is to produce a thick white fluid that creates semen when mixed with the sperm produced by the testes. But you didn't know that one. If we go to the next one.
So why does prostate cancer happen, Tom?
So there are quite a few reasons why prostate cancer can happen. There are a few reasons as to how this can increase as well. So the chances are a little bit higher in certain predisposing factors, which I'll go through in a second. But the main thing is that the main reason for prostate cancer is actually largely unknown, and people don't really understand it completely. But the things that we do know are that being over 50, at the age of 50, can increase your risk. Men of an Afro-Caribbean or African descent, again, are more likely to sort of suffer with prostate cancer, and then less common in Asian men, and also being a hereditary factor as well. So if you have it in the family, whose fathers or fathers also had it, so it can be a hereditary disposition as well. And the last one, they're quite an interesting fact, but recently it's shown that actually obesity can increase the risk of prostate cancer. So if any of those are of concern to you, definitely look into getting yourself checked out. And also obviously reducing the risks in the first place. So if you know that you're obese, what can you start doing to start reducing these risks in the first place?
I'd go back to our nutrition and exercise discussion the other week. So there's some helpful advice here if you follow the link to the video there. So symptoms of prostate cancer, Tom, what would they be?
So, I mean, they're all sort of noted down here, but if I go into a bit more detail as well. So symptoms can be needing to pee more frequently, or also sometimes even seeing blood in the urine as well, going to the toilet a lot during the night, or having to wake up to actually go to the toilet, needing to rush to the toilet, difficulty in actually to start peeing in the first instance, straining or taking a long time, having a weak flow. So if it's sort of dripping or dribbling out, that is another sign there as well. Feeling that your bladder has not fully emptied. So if you feel like there is more but nothing is coming in a sense, that can definitely increase the risk. And as I mentioned earlier, blood in urine and actually or semen. So if you are seeing any of those symptoms, definitely reach out to your GP. Make sure you're getting some tests done, which we're going to go through in a second, to really kind of reduce this risk of either catching it early or reducing the risk in general overall. Loving this delay, we're getting there.
That get larger.
Breaking up a little bit, Derek.
Let's start again.
I think you're back now. Can you hear?
Yeah, stay there. I've dropped out.
Okay.
I've had a lot of internet issues at home over the last week. Maybe I'm back now.
Wonderful. Should we just continue from here?
Yeah, we'll start this page again. Yeah, ready?
Wonderful. So symptoms of prostate cancer. So these symptoms, as it says, do not always mean you have prostate cancer. There are many different things that you can experience, and it may not mean that you have prostate cancer. It could be absolutely anything. As it says, many men's prostate get larger as they get older in general, but that's not because of prostate cancer. Well, not always, should I say, due to prostate cancer. So it's usually prostate enlargement. There's a little video there that you can have a little look at if you have the time to. I would definitely recommend it. But yeah, most important thing is just to know that if you don't know, just get more advice. Simple as that.
Absolutely.
And the different tests that you can get for prostate cancer. So there, it is good to know that there isn't a single test for prostate cancer. There are just lots of parameters we can measure, which show an increase in certain hormones, certain levels, certain values within the body, which we can measure and understand whether you are at higher risk to then be given more accurate tests to do with prostate cancer. So the most common one which you have probably heard of, these ones here, the one that we actually do, which is a PSA test, which is essentially your prostate. It tests to say that the prostate, to test the actual prostate. However, it doesn't test the exact risk of whether you actually have prostate or not. We'll go into that into a slight into a second, into a bit more detail, but it is blood that's taken from the hand or the arm. It's usually the arm, as we do need quite a lot of blood. A physical examination, usually done by your GP. Note, this is something that we cannot do, but it is a physical examination of the prostate. An MRI scan can be done, and a biopsy can be done where they physically take a sample. The biopsy is the best, it's the most accurate as well. So usually when you go through this kind of systems, you'll start with a blood test. You then may get your examination, your prostate examined, and then your MRI and biopsy.
But there's certainly the easiest way is obviously getting the PSA test done. A little bit of blood from the arm, and it counts the actual unit. So so the PSA test in itself.
Yeah. So this PSA test in itself, we'll go into a bit more detail with the PSA testing, because although it is a fantastic and easy way of really kind of just measuring whether you do, it is very important to note that you do get many false negatives, shall I say. So it may pop up quite a few times, and if you've had a PSA test done by myself, you may have got a message received by me saying something might have increased. However, you've gone to your GP, you've had another test, and they've said it's actually fine, there's nothing wrong with you. So the first thing to note is that you can get a lot of false negatives. However, that doesn't necessarily mean that it is a waste of time. For the sake of getting a false negative and finding out actually everything is okay, to the other extreme, you get a false negative, you go over, you get tested additionally, and actually find that there is something underlying. Obviously we don't want to find it, but if you definitely can sort of spot it early, then you want to do that and make sure that we can take the steps to reduce that. So men are over the age of 50. You can actually you can request one from the GP, but as we mentioned before, we are offering them at the moment. Obviously, we aren't able to offer it because of the pandemic. However, once things do start going back to normal, get yourself booked in, and we can definitely measure this for you. So the reason why that is not massively accurate is because the PSA blood test doesn't actually specifically test prostate cancer. It tests certain parameters within the body which lead to the risk of developing prostate cancer. So you can have high levels of certain things, such as the calcium or aluminum in your body, which can lead to the increased risk of prostate cancer. It can be to do with a lot of other things, and the PSA level can be raised by a few other things, regardless of the prostate cancer. So that is the reason why we sort of tend to get false negatives within the measurements that we do take, and they usually are not life-threatening. And if you take an elevated PSA level to your GP, they cannot tell whether that is a life-threatening decision or not they need to make to do with prostate cancer. So although it can give you a very, very good indication and say to you whether you need to be getting checked additionally or further to what we have done, that's fantastic. But as far as that's concerned, that's about as far as that test goes. A little bit like diabetes or something like that, testing the blood sugar and then saying, well, just because you have a high blood sugar doesn't mean that you are diabetic. It might mean that you've just eaten something that has high sugar in it. So good to note that it's not bulletproof, but definitely something that can help and can lead towards a certain diagnosis. And it's definitely good to know that we have had that in the past, and we have diagnosed a high PSA, which has led to certain individuals going to GPs and actually finding out that they have small cases of prostate cancer. So definitely a good test to have. And obviously, once you have the PSA test, then you might find that it has an elevated effect. You will be offered by your GP most probably to have an MRI or some form of biopsy. Yeah.
So it's like an indication of something's wrong.
Yeah.
In reality. So, for the sake of a small amount of blood, it gives you a really good idea of what underlying or unknown conditions that your body is going through. So looking at the treatments there, Tom.
Yeah. So more radically, you can get the prostate completely removed, depending on how far down certain stages are and how quickly the cancer has developed and grown. Radiotherapy, either on its own or alongside with hormone therapy, and they are the sort of main ways that you can sort of cure prostate cancer, or at least slow down the symptoms of that. The best option depends on your age, really. Overall health, both options do involve careful monitoring of your condition as well. So no matter what it is that you do decide, the NHS do make sure that you are definitely well taken care of, as you may have experienced or known somebody else to have gone through a similar thing. So really, really simple. Get yourself checked the same way. Get the PSA tests done. Once we get that advice from the government, we're up and running again. Get yourself booked in. I've actually got quite a lot of emails already from people who are saying that they want PSAs done as soon as they get back. So that's fantastic to know. My list is getting longer, which is fantastic. So as soon as things sort of go back to normal, we can get people tested and get back to normality.
Excellent. Thank you, Tom. And thank you everyone for tuning in and listening to what Tom and I have just run through. Just remember, again, it all starts with you. If you don't feel, certainly in this where we are with COVID-19, if you feel something's not right, go and see your doctor. And as Tom's just pointed out there, once we've got the go ahead, we'll be continuing with the personal medicals, and we'll be able to do PSA tests. But if in the meantime you don't feel you're okay, go and see your registered GP and talk, because the first step obviously starts with you. Thank you very much, everyone. Well, funny enough, one of the people that took up one of these tests for the PMAs was one of our own construction managers, Kevin Isles, and Kevin's very kindly joined us to discuss the PMAs, the PSAs, and here he is. Hello, Kevin.
You all right, Derek?
Hello, mate. So we've just run through a presentation, and what I want to do, if you don't mind, is ask you a couple of questions and go from there, really. And my first question is, before the PMAs that you arranged for the site team, obviously somebody failed to turn up, and you stepped in and done just a random PMA, which included the PSA test. Could you tell everyone what your symptoms were?
None. Didn't have nothing.
No symptoms at all.
No symptoms whatsoever.
Right, but you had the test. Obviously, it came back and elevated. You then went away and obviously went and had the test with your doctor. Just what's your opinion before? And I'm trying to concentrate on before the PMA test. What were your opinions on the PMA test before you had it done?
I thought, yeah, you go in, you get your blood pressure tested, and you like your lung capacity and your height and your weight, and I thought that was it. And I thought, oh, be a complete waste of time. But to be honest with you, Derek, best thing I ever done, saved my life, I think.
Yeah. Well, and I mean, that probably answers my next question, because I was kind of looking about your aspirations for the test. But did you know you was going to do a PSA test as well, which is obviously where they take the blood?
No, I didn't.
No. Okay.
No.
Obviously, thankfully.
I'm so pleased they did.
Yeah, brilliant. You prepared to discuss any of the treatment you had?
Yeah, I had. Obviously, some scans and MRI, biopsies. Mm-hmm. Received a course of hormone injections, and then I received a course of radiotherapy treatment. And from a PSA that was 11.6, it's now dropped to 0.23.
That's fantastic, Kevin. So now we're going back. Now we've had the test. What are your opinions about the actual test now? The PMA test, the personal medicals, and the PSA. What's your opinion on it now?
I reckon if people get offered to have that medical, they should have it done. I would recommend everyone to have it done. There, it was an absolute godsend to me, and not only me. I should imagine there's other people had different illnesses that have been picked up on.
Yeah, absolutely. I mean, there's a lot of stuff with high blood pressure and diabetes. Certainly with myself, I've been sort of now diagnosed with diabetes, but it was picked up in the PMAs. So sort of lastly, Kevin, if you could, I'm going to sort of leave the last word on this with you, but what would you say to anyone who's unsure about having a medical, not just the PSA, but obviously the personal medical assessments that we do? What would you say?
I would say have it. It doesn't cost you nothing, but it could save your life, and it could prevent you having any serious illness. Definitely worth the 45 minutes to an hour of your life.
Brilliant. Well, thank you, Kevin. So everyone on today's session, thank you to Tom. Thank you to you, Kevin. There's really wise words there from somebody who's been affected, and thankfully in recovery mode, Kevin. Yeah.
In recovery mode.
Brilliant, right? And that's all for spending 45 minutes on carrying out personal medical assessment. So it just goes to show it does work, and as Kevin said, if you had the opportunity, please go and do it. Thank you for taking the time to listen today. All the best. Stay safe.